Let's look at some of the pros and cons of epidurals. The biggest pro, of course, is that it is the most effective form of pain relief in labor. That can be really helpful, especially if you've been in labor for several days and you're exhausted. However, this effect can sometimes make it a con. In normal labor without an epidural, as labor progresses, the brain processes the physical sensations and in response releases oxytocin, which causes the uterus to contract. This cycle leads to labor progressing normally. Sometimes when the cycle is blocked by an epidural, contractions may slow down and labor may need to be stimulated with pitocin, which is synthetic oxytocin. The baby may respond differently to pitocin, so the baby needs to be monitored continuously. The birthing person moves during labor to find comfort and responds to the body's cues by getting into positions that feel good. This is how the baby spirals through the pelvis. If there is no feedback from the baby because of the numbing effect of the epidural, the baby may not make all those turns and may need a vacuum, forceps, or a cesarean. Of course, this doesn't always happen, but it could happen. So what can you do about this? If you want an epidural, you could use a variety of other comfort tools for as long as possible in order to get the epidural later in labor. Using labor positions with an epidural that can help the baby move through the pelvis could also be helpful. Learning how to keep labor as normal as possible, even with an epidural, can minimize the need for further interventions. Learning about all the pros and cons of epidurals can help you make an informed choice when the time comes. I'm a Lamaze certified childbirth educator and a Lamaze educator trainer. Follow for more tips.